My name is Richard Cole. I'm the Head of Sterile Services at Addenbrooke's. My role is making sure all medical devices are ready for surgery. We have a lot of operating theatres here and there's many different specialities, so the knowledge needed in regards to what we have to do is huge. The basic journey of instruments is once they're used, they come down to the washroom, where they're then scanned in to make sure we know they're here. We will then separate them out, take them apart, and they'll then be put into a washer disinfector, which goes us through a series of elements in order to make sure it's decontaminated properly. It takes about an hour for that machine to do its thing. It'll then go into a clean room where you have to be specially gowned and don hats and gloves and shoes and things. You would then put it back together again. You'd make sure it's fit for purpose, it's clean and in the right order. It would then be scanned into an autoclave where it's sterilised, and once it comes out, it has to cool naturally to room temperature. It's then dispatched back to the theatre. The whole process takes about 4 hours. I started as a theatre orderly when I was 18 and sort of progressed through from there. So I've been working in and around theatres and sterile services for around 30 years. I think the NHS is uniquely sort of situated for a group of people that you don't get anywhere else. It's a family feeling, you know, it's a real team togetherness I think you find in the NHS. They all really care about patients and doing things that they need to do. The whole satisfaction of the job is really about patient care. When you first start in sterile service, you can come straight in, but it is more of a training role. It can take quite a while because the variety of instruments and knowledge you need is quite large. Once you are competent in every area, maybe running an area in the absence of a team leader, you would then look to the sterile services qualification, which is the technical certificate. And then you would go on to higher qualifications, so foundation degrees, honours, master's degrees and doctorates now as well, so it depends on what we want to follow really. Qualifications are becoming very important in sterile services. It's evolving every day, so legislation changes, technology changes an awful lot, so keeping up to date with everything, understanding what's going on and why it's happening, a lot about machines, knowing what the machines are doing is really important. When I first started in theatres, the terminology was something I'd never come across, and it took quite a bit to learn some of the different phrases that are used, so that's something that I would love to have known beforehand. My advice would be to learn the underpinning knowledge of it, of what you're doing and why you're doing it, and that'll stand you in good stead moving forwards. There are many roles within sterile services. It's just about bringing the different elements of the team together, and people have different skills and different points of view. So if you're at sixth form college or further education and you would like a placement here at Sterile Services, we do look forward to you coming and visiting us, and I hope to see you soon.